Hello everyone, welcome to Vital Men 60, your YouTube channel dedicated to men's reproductive health. I'm Dr. James Edward Carter, a urologist with over 15 years of experience, currently practicing at Mayo Clinic and a member of the American Urological Association. Today, in our first video, we'll dive into a common yet often undiscussed issue, erectile dysfunction, or ED. The goal of this video is to help you understand what ED is, recognize its symptoms, and appreciate why it's a critical health concern. If you have any questions, please feel free to leave them in the comments below. Be sure to follow along for the next videos to gain a comprehensive understanding of this topic. Today, we're exploring erectile dysfunction, commonly known as ED, a prevalent health issue that's rarely discussed openly. Understanding ED not only empowers men to improve their quality of life, but also helps identify serious underlying health conditions early. Let's start with a striking statistic. According to the Massachusetts Male Aging Study, MMAS, by Feldman et al., published in the Journal of Urology, 1994, Vol. 151, pp. 5461, approximately 52% of men aged 40 to 70 in the United States experience ED to some degree. For men over 60, this figure is even more significant. So, what exactly is ED, and why does it matter? Let's find out. Erectile dysfunction is defined as the inability to achieve or maintain an erection sufficient for satisfactory sexual performance, despite having sexual desire. To understand this better, let's look at the physiology of an erection. When a man is sexually aroused, the brain sends signals through the nervous system to the penis. Blood vessels in the penis, particularly in the corpora cavernosa, sponge-like structures, dilate, allowing blood to flow in. As these structures fill with blood, the penis becomes erect. Muscles at the base of the penis then contract to trap the blood, maintaining the erection. If any part of this process is disrupted, for example, if blood vessels don't dilate properly, nerves are damaged, or muscles fail to retain blood, ED can occur. ED is classified into 3 levels of severity: mild, moderate, and severe. In mild cases, you might occasionally struggle to achieve or maintain an erection. Moderate ED involves more frequent difficulties, while severe ED means an almost complete inability to achieve an erection. Regardless of the severity, ED is a treatable condition, and it's crucial not to feel ashamed or discouraged. How common is ED? Let's examine some robust data from reputable studies. The Massachusetts Male Aging Study, MMAS, conducted on 1,290 men in the Boston area from 1987-1989, found that 40% of men aged 60-69 experience ED to some extent. Feldman et al., Journal of Urology, 1994, Vol. 151, pp. 5461. More recent data from the National Health and Sexuality Survey, NHSS, by Bacon et al., published in the Annals of Internal Medicine, 2006, Vol. 144, pp. 427-435, reported that 48% of men aged 65-74 and 52.2% of men over 75 experience ED, based on a survey of 3,005 American men from 2001-2002. These numbers highlight the widespread nature of ED in older age groups. Additionally, the MMAS provides insight into the incidence of ED, new cases that develop over time. For men aged 60 to 69, the study reported an incidence rate of 46.4 new cases per 1,000 men per year, or roughly 4.6% annually, Johannes et al., Journal of Urology, 2000, Vol. 163, pp. 460-463. This means that each year, nearly 5 out of every 100 men in this age group may develop ED for the first time. Why does ED matter? Beyond its impact on sexual health and personal well-being, ED can signal serious underlying conditions. A pivotal study by Thompson et al., published in Circulation, 2005, Vol. 112, pp. 3378 3385, conducted on 9,457 men from 1994-2003 as part of the prostate cancer prevention trial, found that men with ED have a 40% higher risk of cardiovascular disease compared to those without ED. The small blood vessels in the penis are highly sensitive to circulatory issues, making ED an early warning sign of heart disease. Moreover, ED is closely linked to other conditions. According to Selvin et al., published in the American Journal of Medicine, 2007, Vol. 120, pp. 151-157. Approximately 75% of men with type 2 diabetes experience ED to some degree, based on data from the National Health and Nutrition Examination Survey, NHNES, from 2001-2002, with a 455 male participants. Diabetes damages nerves and blood vessels, impairing erectile function. Similarly, a study by Giuliano et al., published in the Journal of Urology, 2004, Vol. 171, pp. 2341-2345, involving 2,026 men in France from 1999-2001, found that 30 to 40% of men with hypertension are at higher risk of ED. The good news? ED is treatable. From lifestyle changes like regular exercise and a healthy diet, to medical interventions such as oral medications or assistive devices. There are numerous ways to address it. Most importantly, don't hesitate to seek help. Over half of men over 60 experience this, and you're not alone. Symptoms of erectile dysfunction. Now, let's explore the symptoms of ED, the signs your body and mind may show when dealing with this condition. Recognizing these symptoms early is crucial, not only to understand the issue, but also as a first step toward finding solutions and protecting your overall health. Let's dive in. What are symptoms? And why do they matter? Symptoms are signals your body sends to indicate something isn't right. With erectile dysfunction, symptoms can vary widely, ranging from physical changes to psychological impacts. Understanding these signs is vital because they help you identify ED and may also alert you to more serious health issues, such as heart disease or diabetes. So, what are the specific symptoms of ED? We'll break them down into two main categories: physical and psychological. Physical symptoms of ED first. Let's discuss the physical symptoms, those directly related to the body. The most obvious and common symptom of ED is difficulty achieving or maintaining an erection. This can manifest in several ways. Inability to achieve an erection despite sexual stimulation. You may feel desire, but the penis doesn't respond as expected. Erections that don't last long enough. The penis may become erect, but loses firmness too quickly, preventing satisfactory intercourse. Erections that aren't firm enough. Even if an erection occurs, it may lack the rigidity needed for comfortable sexual activity. Additionally, ED may be accompanied by other physical signs, such as reduced sexual desire. You might feel less interested in intimacy, sometimes due to hormonal imbalances or other health issues. Difficulty with ejaculation. Some men experience issues like premature ejaculation, delayed ejaculation, or an inability to ejaculate. Pain during erection. Though rare, some may feel discomfort or pain when the penis is erect, possibly due to inflammation or structural issues. These symptoms can occur individually or in combination, and their severity varies from person to person. For example, some men may only occasionally struggle, while others experience persistent issues. Psychological symptoms of ED doesn't just affect the body, it can profoundly impact your mental well-being. Common psychological symptoms include anxiety and stress. Failing to achieve an erection can lead to worry about your performance. This anxiety can worsen ED, creating a vicious cycle. Low self-esteem and embarrassment. Many men feel less confident or even ashamed with their partner, leading them to avoid intimate situations. Depression. If ED persists without resolution, it can lead to feelings of sadness, hopelessness, or loss of interest in life. Relationship strain. ED can cause misunderstandings or conflicts with a partner, affecting emotional closeness and overall happiness. These psychological effects not only make ED more distressing, but also impact your mental health and quality of life. It's crucial to understand that ED isn't your fault. It's a common health issue with solutions. ED as a warning sign for bigger health issues. One critical point is that ED isn't just a sexual problem. It can signal more serious underlying conditions. For example, cardiovascular disease. The blood vessels in the penis are highly sensitive to circulatory issues. ED may be an early sign of heart disease or atherosclerosis. Diabetes. ED is common in men with diabetes, especially type 2, due to nerve and blood vessel damage. Hormonal imbalances. Low testosterone or other hormonal issues can contribute to ED. Other conditions, high blood pressure, high cholesterol, or neurological disorders may also be underlying causes. If you notice persistent ED symptoms, don't delay. Consult a doctor. A comprehensive health check can uncover underlying issues and provide appropriate solutions. Seek help and find solutions. ED is common, and the great news is it's treatable. Don't feel embarrassed or think it's something men shouldn't talk about. Doctors are here to help without judgment. Early intervention can improve your sexual health and protect your overall well-being. You might need lifestyle changes, medications, or treatment for underlying conditions. All are viable options. In summary, we've explored the symptoms of erectile dysfunction, including physical signs like difficulty achieving an erection or reduced libido, and psychological effects like anxiety and low self-esteem. We've also seen that ED can signal larger health issues, making early recognition and medical consultation critical. If you're experiencing these signs, know that you're not alone, and there are ways to improve. In the next section, we'll dive into the causes of ED and how they affect your body. Stay tuned to learn more. The importance of understanding ED. You might think ED is just a minor issue, but in reality, it can profoundly impact your life and even signal more serious health problems. Let's explore why understanding ED is so crucial. Why understanding ED matters. ED isn't just about sexual health. It's a key part of your overall well-being. Knowing about ED helps you recognize that it's not something to be ashamed of or hidden. Instead, it's a treatable medical condition that may point to other health issues. Here are 4 key reasons why understanding ED is vital. 1. Impact on quality of life. ED doesn't just affect your ability to have sex. It can lead to significant psychological challenges. Imagine feeling self-conscious, anxious, or even depressed because you can't perform as expected. Many men feel inadequate, which can strain their relationship with their partner. You might start avoiding intimacy, creating distance in your relationship. This isn't just your issue, it affects those you care about. Understanding ED helps you see that you're not alone and that many others face the same challenges. By grasping the issue, you're more likely to seek help and communicate with your partner, reducing stress and boosting confidence. 2. ED as a warning sign. One of the most critical reasons to understand ED is its potential as an early indicator of serious health issues. Did you know that the blood vessels in the penis are highly sensitive to circulatory problems? This means ED can be the first sign of cardiovascular disease, high blood pressure, or diabetes. If you experience ED, your body might be signaling a deeper issue. For instance, if you have ED without an obvious cause, it's wise to check your cardiovascular health. Tests may reveal circulatory issues. Similarly, if you're at risk for diabetes, ED could be an early clue. Recognizing and addressing ED can help you detect and manage these conditions sooner. Protecting your health. 3. Treatability of ED. Many people don't realize that ED is highly treatable. Understanding available treatment options empowers you to seek help and improve your condition. There are numerous ways to address ED, from lifestyle changes to medical interventions. For example, you can start with regular exercise, a healthy diet, and stress reduction. These changes not only help with ED, but also benefit your overall health. If needed, consult a doctor about medications like Viagra or Cialis, or devices like vacuum pumps. The key is that you don't have to suffer in silence. Effective solutions are available. 4. Reducing stigma and encouraging dialogue. Finally, educate. Hello everyone, and welcome back to our series on men's health. In our previous video, we explored what erectile dysfunction is and why it matters. In this video, we'll dive deep into the causes of erectile dysfunction. If you're experiencing this issue or simply want to learn more to prevent it, stick around until the end, and don't forget to hit like and subscribe to stay updated with our next episode. Erectile dysfunction, ED, is defined as the persistent difficulty in achieving or maintaining an erection sufficient for satisfactory sexual intercourse. It's a common condition, affecting approximately 30 million men in the United States, according to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK. Symptoms and causes of erectile dysfunction. In this segment, we'll examine the primary physical causes of ED, including cardiovascular disease, diabetes, hormonal imbalances, neurological disorders, medication side effects, and other factors such as obesity. All information presented is grounded in scientific research from reputable sources such as the Journal of the American College of Cardiology, Diabetes Care, and Mayo Clinic. Part 1. Physical causes. 1. Cardiovascular disease. Cardiovascular diseases, such as atherosclerosis or coronary artery disease, are among the leading causes of ED. According to a study published in the Journal of the American College of Cardiology, ED is a strong predictor of coronary artery disease, with men experiencing ED having a 50% higher risk of heart disease compared to those without the condition, erectile dysfunction, and coronary artery disease. Mechanism: atherosclerosis causes narrowing or blockage of blood vessels, reducing blood flow to the penis, which is critical for achieving an erection. Additionally, endothelial dysfunction impairs the production of nitric oxide, a key chemical that facilitates blood vessel dilation. Evidence: a study in the International Journal of Impotence Research found that men with ED have a higher prevalence of cardiovascular risk factors, such as hypertension and elevated cholesterol, erectile dysfunction as a predictor. Thus, prioritizing cardiovascular health not only protects your heart, but also helps maintain your sexual performance. 2. Diabetes. Diabetes significantly increases the risk of ED. According to Diabetes Care, the prevalence of ED in men with diabetes ranges from 35% to 75%, depending on age and glycemic control. Erectile dysfunction in diabetes. A study in the Journal of Sexual Medicine further confirms that diabetes increases the risk of ED threefold compared to men without diabetes, and erectile dysfunction. Mechanism. Diabetes causes damage to both blood vessels and nerves. Elevated blood glucose levels lead to the formation of advanced glycation end products, AGEs, which impair endothelial function and obstruct blood flow. Concurrently, diabetic neuropathy disrupts nerve signals from the brain to the penis. Solution: tight glycemic control through diet. Exercise and medication can reduce the risk or improve ED in men with diabetes. 3. Hormonal imbalances. Hormones, particularly testosterone, play a critical role in erectile function. According to the Journal of Clinical Endocrinology and Metabolism, testosterone deficiency, also known as hypogonadism, is associated with ED in 10% to 20% of affected men. Testosterone and erectile function. Mechanism: low testosterone levels reduce sexual desire and impair the production of nitric oxide, hindering blood vessel dilation in the penis. Evidence: a study in the Asian Journal of Andrology found that testosterone replacement therapy can improve erectile function in men with hypogonadism. Testosterone and erectile function. If you suspect a hormonal issue, a blood test ordered by your doctor is the essential first step. 4. Neurological disorders. Neurological conditions such as Parkinson's disease, multiple sclerosis, or spinal cord injuries can contribute to ED. A study in the Journal of Neurology, Neurosurgery and Psychiatry indicates that ED is prevalent among men with Parkinson's disease, erectile dysfunction in Parkinson's disease, while the Multiple Sclerosis Journal reports ED as a common symptom in multiple sclerosis, sexual dysfunction in multiple sclerosis. Mechanism: nerves responsible for erections transmit signals from the brain to the penis. Neurological disorders disrupt these signals, severely impairing erectile function. Example: in men with spinal cord injuries, the extent of nerve damage determines the ability to maintain an erection. 5. Medication side effects. Certain medications can cause ED as a side effect. According to Mayo Clinic, commonly implicated drugs include antidepressants, SSRIs, antihypertensive drugs, beta blockers, antihistamines. Evidence: approximately 25% of ED cases are linked to medication side effects. Per Mayo Clinic statistics, medications that can cause erectile dysfunction. If you suspect your medication is affecting your erectile function, consult your doctor to explore alternative treatments or adjustments. 6. Obesity and metabolic syndrome. Obesity and metabolic syndrome, characterized by hypertension, insulin resistance, and dyslipidemia, are significant risk factors for ED. A study in the Journal of Sexual Medicine found that obese men have a significantly higher prevalence of ED, obesity and erectile dysfunction. Similarly, the International Journal of Obesity confirms that metabolic syndrome increases the risk of ED, obesity, and sexual dysfunction. Mechanism: obesity induces chronic inflammation and endocrine dysfunction, reducing blood flow and testosterone levels. Solution: weight loss, regular exercise, and a healthy diet can significantly improve erectile function, as supported by research. Conclusion: physical causes such as cardiovascular disease, diabetes, hormonal imbalances, neurological disorders, medication side effects, and obesity all contribute to ED. Importantly, many of these factors are preventable or treatable through lifestyle changes and medical interventions. Consult a healthcare provider to identify specific causes and develop a tailored treatment plan. Part 2. Psychological causes of erectile dysfunction. Erectile dysfunction, ED, is not solely driven by physical issues. Psychological factors also play a significant role. According to Cleveland Clinic, approximately 10 to 20% of ED cases are purely psychological, and in many instances, psychological factors exacerbate physical causes. Psychological causes of erectile dysfunction. In this section, we'll explore 4 primary psychological causes of ED: stress, depression, performance anxiety, and relationship issues. Each cause will be analyzed in terms of its mechanisms, supported by scientific evidence from sources like the Journal of Sexual Medicine, Psychological Medicine, and Mayo Clinic, along with practical solutions. 1. Stress. How does stress affect ED? Stress, particularly chronic stress, is one of the most common psychological causes of ED. When the body is under stress, the sympathetic nervous system is activated, leading to vasoconstriction and reduced blood flow to the penis, a critical factor for achieving and maintaining an erection. Stress also elevates cortisol levels, a hormone that suppresses testosterone production, directly impacting libido and sexual function. Scientific evidence. A study in the Journal of Sexual Medicine found that men with high stress levels have a 39% increased risk of ED compared to those with lower stress. Stress and erectile dysfunction. Research in psychoneuroendocrinology indicates that elevated cortisol due to stress reduces blood flow to the genital organs, impairing the erection process. Cortisol and sexual function. Solutions. To mitigate the impact of stress. Techniques such as meditation, yoga, or regular exercise can help regulate the nervous system and lower cortisol levels. Consulting a mental health professional to develop effective stress management strategies is also a valuable option. 2. Depression. How are depression and ED related? Depression affects not only mood, but also sexual function. Individuals with depression often lose interest in activities, including sexual intercourse, leading to reduced libido and difficulty achieving an erection. Additionally, certain antidepressants, such as SSRIs, selective serotonin reuptake inhibitors, may cause ED as a side effect. Biological mechanism. Depression reduces levels of serotonin and dopamine, neurotransmitters critical for sexual desire and arousal. This disrupts neural signaling from the brain to the penis, impairing the erection process. Scientific evidence. A study in the Journal of Affective Disorders found that approximately 25% of men with depression experience sexual dysfunction, with ED being a prevalent symptom. Depression and sexual dysfunction. Research in psychological medicine confirms that men with depression have a 2-fold higher risk of ED compared to those without depression, and erectile dysfunction. Solutions. Treating depression with psychotherapy, cognitive behavioral therapy, or CBT, combined with medications adjusted to minimize sexual side effects, and lifestyle changes can improve both mood and erectile function. 3. Performance anxiety, the vicious cycle of anxiety. Performance anxiety occurs when men worry about their ability to perform sexually. According to Mayo Clinic, this anxiety can create a vicious cycle. Anxiety leads to erectile failure, which in turn heightens anxiety. Worsening ED, erectile dysfunction, symptoms and causes. Mechanism of impact: anxiety triggers the fight or flight response, increasing adrenaline levels and causing vasoconstriction, which restricts blood flow to the penis. Additionally, a preoccupied mind reduces the ability to focus and relax, 2 essential factors for achieving an erection. Scientific evidence. A study in the Journal of Sexual Medicine indicates that approximately 20% of men under 40 with ED attribute it to performance anxiety, psychogenic erectile dysfunction. Research in the International Journal of Impotence Research shows that cognitive behavioral therapy, CBT, significantly improves ED in men with performance anxiety, CBT for erectile dysfunction. Solutions employing CBT to address negative thought patterns. Practicing relaxation techniques, deep breathing, and fostering open communication with a partner can break this cycle and enhance sexual function. 4. Relationship issues. Relationship dynamics and ED relationship problems, such as conflicts, lack of communication, or emotional disconnection, can contribute to ED. When a relationship is strained, men may feel pressured or lose sexual desire, leading to difficulties maintaining an erection. Mechanism of impact conflicts. Generate stress and anxiety, affecting the nervous system and hormonal balance. A lack of intimacy or misunderstandings about sexual needs can also reduce arousal and desire. Scientific evidence. A study in the Journal of Sexual Medicine identifies marital issues as a strong predictor of ED, relationship issues, and erectile dysfunction. Research in the Archives of Sexual Behavior found that men in unhappy relationships have a significantly higher prevalence of ED, relationship satisfaction, and sexual function. A study in the Journal of Sex and Marital Therapy demonstrates that couples therapy improves both relationship quality and sexual function. Couples therapy for erectile dysfunction. Solutions: improving communication, engaging in couples therapy, and dedicating time to rebuild emotional connection can resolve these issues and restore erectile function. Conclusion: stress, depression, performance anxiety, and relationship issues are key psychological causes of erectile dysfunction. These factors not only affect the mind, but also directly influence biological mechanisms, including hormones, neural signaling, and blood flow. Treating ED requires more than medication. Addressing the psychological roots through therapy, stress management, and improved relationships is crucial. If you're experiencing ED, consider seeking support from a psychologist or physician for a tailored approach. Part 3. Unhealthy lifestyle factors causing erectile dysfunction. Unhealthy lifestyle choices are a major contributor to erectile dysfunction, ED, affecting millions of men worldwide. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, habits such as smoking, obesity, excessive alcohol consumption, and physical inactivity not only increase the risk of ED, but also exacerbate other health issues, symptoms, and causes of erectile dysfunction. In this section, we'll analyze 4 key lifestyle factors: smoking, obesity, excessive alcohol use, and physical inactivity, discussing their mechanisms, supporting scientific evidence, and practical solutions for improvement. 1. Smoking. How does smoking affect ED? Smoking is a significant risk factor for ED due to its damaging effects on blood vessels and reduced blood flow to the penis, which is essential for achieving an erection. Nicotine and other chemicals in tobacco cause vasoconstriction and impair the production of nitric oxide, a critical chemical for blood vessel dilation and erection. Scientific evidence. A study in the American Journal of Epidemiology found that smokers have a 1.5 to 2 times higher risk of ED compared to non-smokers, with the risk increasing with the number of cigarettes smoked daily, smoking, and erectile dysfunction. According to the Journal of Sexual Medicine, quitting smoking can improve erectile function within 6 to 12 months in long-term smokers, smoking cessation, and erectile function. Solutions. Quitting smoking is the critical first step. Smoking cessation programs, including nicotine replacement therapy or behavioral counseling, can help break the habit. Additionally, improving cardiovascular health through diet and exercise supports the recovery of erectile function. 2. Obesity. How are obesity and ED related? Obesity increases the risk of ED through multiple mechanisms, including vascular damage, hormonal imbalances, and chronic inflammation. According to Mayo Clinic, obese men have a significantly higher risk of ED compared to those with a healthy weight. Erectile dysfunction, symptoms and causes. Obesity is often associated with metabolic syndrome, which includes hypertension, insulin resistance, and dyslipidemia, all contributing to ED. Biological mechanism: vascular damage. Excess adipose tissue causes chronic inflammation, damaging the vascular endothelium and reducing blood flow to the penis. Hormonal imbalance. Obesity lowers testosterone levels by increasing the conversion of testosterone to estrogen in fat tissue. Metabolic syndrome. Hypertension and insulin resistance impair vascular function, directly affecting erectile capacity. Scientific evidence. A study in the Journal of Sexual Medicine found that men with a body mass index, BMI, above 30 have a 30% higher risk of ED compared to those with a normal BMI, obesity, and erectile dysfunction. Research in the International Journal of Obesity confirms that weight loss through diet and exercise can improve erectile function in obese men, obesity and sexual dysfunction. Solutions: weight loss through a healthy diet, rich in vegetables, fruits, and lean protein, and regular exercise, at least 150 minutes per week, can significantly enhance erectile function. Consulting a nutritionist or physician to develop a safe and effective weight loss plan is recommended. 3. Excessive alcohol consumption. Impact of alcohol on ED chronic. Excessive alcohol consumption is a significant risk factor for ED. While small amounts of alcohol may reduce inhibition, excessive or frequent drinking can damage nerves, lower testosterone, and impair vascular function. Biological mechanism. Nerve damage. Alcohol causes damage to the central and peripheral nervous systems, disrupting signals from the brain to the penis. Testosterone reduction. Excessive alcohol suppresses testosterone production, affecting libido and erectile capacity. Vascular damage. Alcohol induces inflammation and endothelial damage, reducing blood flow necessary for erections. Scientific evidence. A study in the Journal of Sexual Medicine found that men who abuse alcohol have a 1.7 times higher risk of ED compared to moderate drinkers. Alcohol and erectile dysfunction. According to Australian prescriber, chronic alcohol abuse increases the prevalence of ED and other sexual dysfunctions. Drug-induced sexual dysfunction. Solutions: limiting alcohol intake to moderate levels, no more than 2 standard drinks per day for men, or abstaining entirely is recommended. Participation in alcohol cessation programs, such as Alcoholics Anonymous, or consulting a physician can support improvements in overall health and sexual function. 4. Physical inactivity. Physical inactivity and ED. A sedentary lifestyle increases the risk of ED by negatively affecting cardiovascular health, hormone levels, and blood flow. According to the American Journal of Public Health, physically inactive men have a 40% higher risk of ED compared to those who exercise regularly. Physical activity and erectile dysfunction. Biological mechanism. Cardiovascular health. Inactivity contributes to hypertension, high cholesterol, and atherosclerosis, all of which reduce blood flow to the penis. Hormone levels. Exercise boosts testosterone production and improves mood, while inactivity suppresses these benefits. Chronic inflammation. A sedentary lifestyle increases systemic inflammation, damaging blood vessels and impairing erectile function. Scientific evidence. A study in the Journal of Sexual Medicine shows that moderate intensity exercise, brisk walking or jogging for 30 minutes per day, 5 days a week, can reduce the risk of ED in middle-aged men, exercise and erectile function. Research in the British Journal of Sports Medicine indicates that men who exercise regularly have significantly better erectile function compared to sedentary peers, physical activity, and sexual health. Solutions start with simple exercises like brisk walking, jogging, or weight training for at least 150 minutes per week. Cardiovascular exercises, such as cardio or HIIT, are particularly effective in improving blood flow and erectile function. Conclusion: unhealthy lifestyle factors, including smoking, obesity, excessive alcohol consumption, and physical inactivity, are major contributors to erectile dysfunction. The good news is that these habits are modifiable, offering opportunities to improve both sexual health and overall well-being. Quitting smoking, losing weight, moderating alcohol intake, and staying active can significantly reduce the risk of ED. If you need support, consult a healthcare provider or specialist to create a personalized plan. Part 4. Impact of aging on erectile dysfunction. Aging is an inevitable factor that significantly affects erectile function. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, erectile dysfunction, ED, becomes more prevalent as men age, affecting approximately 30 million men in the United States, particularly in middle and older age groups. Symptoms and causes of erectile dysfunction. In this section, we'll analyze how aging impacts ED through biological changes, prevalence statistics, and solutions to maintain sexual health. All information is supported by research from the Journal of Sexual Medicine, New England Journal of Medicine, and Mayo Clinic. 1. Biological changes. Due to aging testosterone decline. As men age, levels of testosterone, a critical hormone for libido and erectile function, gradually decline. According to the Journal of Clinical Endocrinology and Metabolism, testosterone decreases by approximately 1 to 2% per year after age 30. Testosterone decline with aging. This reduction not only diminishes sexual desire, but also affects nitric oxide production, essential for blood vessel dilation and erections. Mechanism: low testosterone reduces neural signaling from the brain to the penis and impairs vascular dilation. Additionally, testosterone influences mood and energy, indirectly affecting sexual health. Vascular dysfunction. Aging reduces blood vessel elasticity, a condition known as atherosclerosis. According to the New England Journal of Medicine, this limits blood flow to the penis, making it difficult to achieve or maintain an erection. Vascular causes of erectile dysfunction. Reduced vascular flexibility also diminishes the efficacy of nitric oxide in the erection process. Mechanism: blood vessels become sclerotic or obstructed by plaque buildup, reducing the blood volume necessary for sustained erections. Neurological damage. The nervous system is also affected by aging, leading to reduced sensitivity of neural signals from the brain to the penis. According to the Journal of Sexual Medicine, age-related neurological changes, such as reduced neuron count or peripheral nerve damage, disrupt the erectile process, neurogenic erectile dysfunction. Mechanism: weakened neural signals impair the activation of the erectile mechanism, particularly in individuals with underlying conditions like diabetes or cardiovascular disease. 2. Prevalence of ED by age research data. ED becomes more common with advancing age. The Massachusetts Male Aging Study, MMAS, a landmark study on men's health, found approximately 52% of men aged 40 to 70 experience some degree of ED, ranging from mild to severe. Prevalence of erectile dysfunction. The prevalence increases significantly with age, about 40% in men aged 40, 50% in men aged 50, and up to 70% in men aged 70. A study in the Journal of Sexual Medicine confirms that age is an independent risk factor for ED. Even in the absence of comorbidities, age and erectile dysfunction. Contributing factors. Aging is often accompanied by chronic conditions such as diabetes, hypertension, and cardiovascular disease, which amplify the risk of ED. According to Mayo Clinic, older men are more likely to have these comorbidities, exacerbating ED, erectile dysfunction, symptoms and causes. 3. Other age-related factors, medication and chronic conditions. Older men often take multiple medications for chronic conditions, such as antihypertensives or antidepressants, which can cause ED as a side effect. According to Cleveland Clinic, about 25% of ED cases in older men are linked to medications and erectile dysfunction. Psychological changes. Aging may also bring psychological changes, such as stress or depression due to job loss, retirement, or health concerns. As discussed in Part 2, these factors increase the risk of ED. 4. Solutions to mitigate the impact of aging lifestyle changes. Maintaining a healthy lifestyle can slow the age-related decline in erectile function. According to the British Journal of Sports Medicine, older men who exercise regularly, brisk walking or cardio for 150 minutes per week, have significantly better erectile function, physical activity, and sexual health. Diet. A diet rich in vegetables, fruits, and healthy fats, Mediterranean diet, improves cardiovascular health and blood flow. Exercise. Activities like cardio, weight training, or yoga boost testosterone and enhance circulation. Adequate sleep. Quality sleep regulates hormones and reduces stress. Medical interventions testosterone therapy. According to the Journal of Clinical Endocrinology and Metabolism, testosterone replacement therapy can improve erectile function in older men with testosterone deficiency, testosterone therapy, and erectile function. However, consultation with a physician is necessary to weigh benefits and risks. Erectile dysfunction medications. Drugs like sildenafil, Viagra, or tadalafil, Cialis, enhance blood flow to the penis. Effective in older men, PDE5 inhibitors. Regular checkups. Early detection and management of conditions like diabetes or hypertension can reduce ED risk. Psychological support. If ED in older men is linked to anxiety or depression. Cognitive behavioral therapy, CBT, or counseling can improve mood and restore confidence, CBT for erectile dysfunction. Conclusion. Aging increases the risk of erectile dysfunction through declining testosterone, vascular dysfunction, and neurological damage. However, ED is not an inevitable part of aging. Lifestyle changes, medical interventions, and psychological support can help men maintain sexual health at any age. If you're experiencing issues, consult a healthcare provider to identify specific causes and develop a tailored plan. Erectile dysfunction can stem from various causes, but the key takeaway is that you don't have to face it alone. In our next episode, we'll explore when you should see a doctor and the first steps to address this issue. Don't miss out. Hit the notification bell to get updated as soon as the video drops. If you found this video helpful, please share it with friends and leave a comment about topics you'd like us to cover next. Thank you for watching. Stay tuned to our channel for more insights on men's health. See you in the next video. Welcome back to Vital Men 60, our series on men's health. In today's video, we'll dive into a critical topic. When should you see a doctor when dealing with erectile dysfunction, ED, This isn't just an issue that impacts your sex life. It can also be a warning sign of more serious health conditions. What is erectile dysfunction? Erectile dysfunction, ED, is defined as the persistent difficulty in achieving or maintaining an erection sufficient for satisfactory sexual activity. It's a common condition, yet many men hesitate to talk about it due to stigma or embarrassment. Why should you pay attention to ED? ED is more than just a sexual function issue. It can serve as an early warning sign of serious health conditions such as cardiovascular disease, diabetes, or hormonal imbalances. Recognizing and addressing ED promptly can improve your quality of life and, in some cases, even save your life. Statistics on ED. According to the National Institute of Diabetes and Digestive and Kidney Diseases, NIDDK, ED affects approximately 30 million men in the United States. Symptoms and causes of erectile dysfunction. The Massachusetts Male Aging Study, MMAS, found that 52% of men aged 40 to 70 experience some degree of ED, prevalence of erectile dysfunction. A study in the Journal of Sexual Medicine shows that the prevalence of ED increases with age. 40% in men aged 40, 50% in men aged 50, and up to 70% in men aged 70, age and erectile dysfunction. Goal of this video. We aim to help you identify the key signs to watch for, overcome any hesitation, and take proactive steps to seek medical help when needed. Let's dive into the details. Part 1. Signs to watch for erectile dysfunction, ED, is not merely a sexual function issue. It can signal underlying health problems. Recognizing the signs of ED early is crucial for protecting your health. In this section, we'll explore the primary symptoms of ED, associated symptoms, and warning signs of serious conditions. All information is grounded in scientific research from reputable sources such as the Journal of Sexual Medicine, Mayo Clinic, and Cleveland Clinic. 1. Primary signs of erectile dysfunction, ED. ED is defined as the difficulty in achieving or maintaining an erection sufficient for sexual activity. According to the NIDDK, ED affects approximately 30 million men in the U.S. Symptoms and causes of erectile dysfunction. Here are the 3 main signs to watch for. A. Difficulty achieving an erection. Description. You are unable to achieve an erection despite adequate sexual stimulation. This may occur in most sexual encounters, or only occasionally. Causes. This can result from vascular issues, hormonal imbalances, or psychological factors. According to Mayo Clinic, approximately 80% of ED cases have a physical cause, with vascular problems being the most common. Erectile dysfunction, symptoms and causes. B. Difficulty maintaining an erection. Description. You can achieve an erection but cannot sustain it long enough for sexual intercourse. The erection may fade during the act or lack sufficient firmness. Causes. This is often linked to impaired blood flow or nerve damage. A study in the Journal of Sexual Medicine found that men with diabetes are 3 times more likely to struggle with maintaining an erection compared to healthy men. Diabetes and erectile dysfunction. C. Reduced sexual desire. Description. You experience a lack of interest or reduced desire for sexual activity, which may occur alongside erection difficulties or independently. Causes. This is often due to hormonal imbalances, particularly low testosterone levels, or psychological factors like stress. According to Cleveland Clinic, 10 to 20% of men with ED have low testosterone and erectile dysfunction. If any of these signs persist for more than 3 months, it's a clear indication that you should consult a doctor. The American Urological Association emphasizes that early diagnosis and treatment can significantly improve quality of life and prevent health complications. Erectile Dysfunction Clinical Guidelines. 2. Associated symptoms. ED rarely occurs in isolation. It is often accompanied by other symptoms that may point to underlying health issues. Below are the key associated symptoms to watch for. A. Pelvic pain or discomfort. Description: persistent pain, aching, or discomfort in the pelvic area, which may radiate to the penis or testicles. Causes: this could be related to prostate issues, such as prostatitis or benign prostatic hyperplasia, BPH. A study in the Journal of Urology found that men with prostatitis have a 2.5 times higher risk of ED compared to those without prostatitis and erectile dysfunction. B. Frequent nighttime urination or difficulty urinating. Description: waking up multiple times at night to urinate, or experiencing issues like hesitancy, weak stream, or incomplete bladder emptying. Causes: these are common signs of diabetes or prostate issues. According to Diabetes Care, 35–75% of men with diabetes experience ED, and frequent nighttime urination is a prevalent symptom. Erectile dysfunction in diabetes. C. Fatigue or lack of energy. Description: persistent tiredness, lack of vitality, or insufficient energy for daily activities, even with adequate rest. Causes: this could indicate low testosterone levels or underlying conditions like cardiovascular disease. A study in the Journal of Clinical Endocrinology and Metabolism found that men with low testosterone are more likely to experience fatigue and ED, testosterone and fatigue. D. Mood changes. Description: feelings of anxiety, depression, or chronic stress, particularly related to sexual performance, which may lead to avoidance of intimate situations. Causes: ED and psychological issues often have a bidirectional relationship. Psychological medicine reports that men with depression have a twofold higher risk of ED, depression and erectile dysfunction. If you notice any of these symptoms alongside ED, consider it a prompt to seek medical attention as soon as possible. 3. Warning signs of serious health conditions. ED is not just a sexual issue. It can act as a red flag for more serious health conditions. Below are key conditions that ED may signal. A. Cardiovascular disease. Connection: ED shares risk factors with cardiovascular disease, such as atherosclerosis, hypertension, and high cholesterol. According to the Journal of the American College of Cardiology, men with ED have a 50% higher risk of heart disease, erectile dysfunction, and coronary artery disease. Signs: sudden onset of ED or accompanying symptoms like chest pain, shortness of breath, or fatigue during exertion warrant immediate medical evaluation. B. Diabetes. Connection: diabetes damages blood vessels and nerves, contributing to ED. The American Diabetes Association notes that 35–75% of men with diabetes experience ED, diabetes, and sexual health. Signs: symptoms like excessive thirst, frequent urination, or slow-healing wounds alongside ED suggest the need for blood glucose testing. C. Hormonal imbalances. Connection: low testosterone is a common cause of ED in older men. Mayo Clinic estimates that 10–20% of ED cases are linked to hormonal issues, low testosterone and erectile dysfunction. Signs: reduced libido, fatigue, or loss of muscle mass may indicate the need for testosterone level testing. D. Neurological disorders. Connection: conditions like Parkinson's disease, multiple sclerosis, or spinal cord injuries can disrupt nerve signals, causing ED. A study in the Journal of Neurology, Neurosurgery and Psychiatry found that ED is common in men with Parkinson's disease, erectile dysfunction in Parkinson's disease. Signs: symptoms like tremors, muscle stiffness, or balance issues alongside ED require consultation with a neurologist. 4. key statistics. To highlight the prevalence and importance of early recognition of ED, here are some notable statistics. According to the International Journal of Impotence Research, men who smoke have a 1.5 to 2 times higher risk of ED due to vascular damage, smoking, and erectile dysfunction. A study in the Journal of Sexual Medicine found that obese men have a 30% higher risk of ED compared to those with normal weight, obesity, and erectile dysfunction. Cleveland Clinic reports that 25% of ED cases are linked to medication side effects, particularly antidepressants and antihypertensives, medications, and erectile dysfunction. These statistics underscore that ED is not an isolated issue, but often tied to lifestyle factors and underlying conditions, making early action critical. Part 2. When should you see a doctor? Erectile dysfunction, ED, is not just a sexual performance issue. It can be a warning sign of serious health conditions. Yet, many men delay seeking medical help due to embarrassment or stigma. This section provides detailed information on the specific signs of ED, associated symptoms, and why timely medical consultation is essential. All information is supported by scientific research from sources like the Journal of Sexual Medicine, Mayo Clinic, Cleveland Clinic, and NIDDK. 1. Understanding the primary signs of erectile dysfunction, ED. ED is defined as the inability to achieve or maintain an erection sufficient for sexual intercourse. According to the NIDDK, it affects approximately 30 million men in the US. Symptoms and causes of erectile dysfunction. Below are the key signs to recognize. A. Difficulty achieving an erection. Manifestation. You cannot achieve an erection despite adequate sexual stimulation from a partner or other stimuli. Visual or auditory. This may occur frequently, 50% of sexual encounters, or occasionally, 25%. Potential causes, often linked to poor blood flow, nerve damage, or psychological issues like anxiety. Mayo Clinic notes that 80% of ED cases are due to physical causes, particularly vascular issues, erectile dysfunction, symptoms and causes. When to see a doctor? If this occurs in more than 50% of sexual encounters and persists for over 3 months, consult a urologist or men's health specialist. B. Difficulty maintaining an erection. Manifestation. An erection is achieved initially, but fades before or during intercourse, or lacks sufficient firmness. For example, the penis may soften mid-act or fail to reach full rigidity. Potential causes, often related to vascular issues, atherosclerosis, or nerve damage from diabetes. A Journal of Sexual Medicine study found that men with diabetes are 3 times more likely to have this issue, diabetes and erectile dysfunction. When to see a doctor? If this occurs frequently, 75% of encounters, for 2 to 3 months, seek a comprehensive health evaluation, focusing on blood glucose and cardiovascular health. C. Reduced sexual desire. Manifestation. A lack of interest in sexual activity, even when opportunities or stimuli are present. This may accompany erection difficulties or occur independently. Potential causes, often due to low testosterone, chronic stress, or depression. Cleveland Clinic notes that 10 to 20% of ED cases are linked to low testosterone and erectile dysfunction. When to see a doctor? If loss of libido persists for over 3 months and impacts personal life. Test hormone levels and mental health. Note: the American Urological Association recommends consulting a doctor if any of these signs persist for over 3 months to ensure accurate diagnosis and timely treatment. Erectile dysfunction clinical guidelines. 2. Associated symptoms to watch for ED is often accompanied by other symptoms that may indicate serious health issues. Below are key symptoms to monitor. A. Pelvic pain or discomfort. Manifestation: persistent aching, soreness or discomfort in the pelvic region, penis, or testicles, especially after intercourse or prolonged sitting. Potential causes may be due to prostatitis or benign prostatic hyperplasia, BPH. A Journal of Urology study found that men with prostatitis have a 2.5 times higher risk of ED, prostatitis, and erectile dysfunction. When to see a doctor: if pain persists for over 1 month or disrupts daily activities, consult a urologist. B. Frequent nighttime urination or difficulty urinating. Manifestation: waking up more than twice nightly to urinate or experiencing hesitancy, weak stream, or incomplete emptying. May include burning during urination. Potential causes: linked to diabetes or prostate issues. Diabetes Care reports that 35 to 75% of men with diabetes experience ED, with frequent nighttime urination as a common sign. Erectile dysfunction in diabetes. When to see a doctor: if symptoms persist for over 2 weeks or include signs of infection, cloudy or foul-smelling urine. Seek immediate evaluation. C. Prolonged fatigue and lack of energy. Manifestation: feeling exhausted or lacking energy for daily tasks, even after adequate rest. Potential causes may indicate low testosterone, cardiovascular issues, or poor circulation. The Journal of Clinical Endocrinology and Metabolism found that men with low testosterone are more prone to fatigue and ED, testosterone and fatigue. When to see a doctor: if fatigue lasts over 1 month and affects quality of life, check hormone levels and cardiovascular health. D. Mood changes or anxiety. Manifestation: persistent anxiety, depression, or lack of confidence, especially regarding sexual performance, leading to avoidance of intimate situations. Potential causes: ED and psychological issues often exacerbate each other. Psychological medicine notes that men with depression have a 2-fold higher risk of ED, depression, and erectile dysfunction. When to see a doctor: if negative moods persist for over 2 months or strain relationships, consult a psychologist or men's health specialist. 3. ED as a warning sign of serious conditions. ED can serve as an early indicator of serious health issues. Below are common conditions linked to ED. A. Cardiovascular disease. Connection: ED often precedes cardiovascular issues by 2 to 5 years due to atherosclerosis reducing blood flow. The Journal of the American College of Cardiology reports a 50% higher risk of heart disease in men with ED, erectile dysfunction, and coronary artery disease. Associated signs: chest pain, shortness of breath, or fatigue during exertion. B. Diabetes. Connection: diabetes damages blood vessels and nerves, causing ED. The American Diabetes Association states that 75% of men with diabetes experience ED, diabetes, and sexual health. Associated signs: excessive thirst, frequent urination, or slow-healing wounds. C. Hormonal imbalances. Connection: low testosterone contributes to ED and reduced libido. Mayo Clinic estimates 10 to 20% of ED cases are hormone-related, low testosterone and erectile dysfunction. Associated signs: muscle loss, fatigue, or hair loss. D. Neurological disorders. Connection: conditions like Parkinson's or spinal cord injuries disrupt nerve signals, causing ED. The Journal of Neurology, Neurosurgery and Psychiatry notes that ED is common in men with Parkinson's, erectile dysfunction and Parkinson's disease. Associated signs: tremors, muscle stiffness, or balance issues. When to seek immediate care: if ED appears suddenly or is accompanied by severe symptoms like chest pain, shortness of breath, or tremors, visit a hospital immediately. 4. Conclusion and advice. ED is not something to be ashamed of or ignored. It can impact overall health and signal serious conditions. Watch for these signs: difficulty achieving or maintaining an erection for over 3 months, persistent reduced sexual desire, associated symptoms like pelvic pain, frequent urination, fatigue, or mood changes. Don't delay. If you experience these signs, schedule a consultation with a specialist for a thorough evaluation. Early treatment can enhance quality of life and prevent serious complications. Act today to safeguard your health. Part 3. The diagnostic process for erectile dysfunction. Erectile dysfunction, ED, is the difficulty in achieving or maintaining an erection sufficient for sexual intercourse. To diagnose and treat it effectively, doctors follow a comprehensive process involving medical history collection, physical examination, laboratory tests, psychological evaluation, and sometimes specialized tests. This section explains each step in detail, helping you understand how ED signs are assessed by medical professionals. 1. Medical history collection. The first step in diagnosing ED is gathering detailed information about your health and symptoms. This helps doctors understand the context and identify risk factors. A. Symptoms and onset. Signs to watch. 4. You may notice an inability to achieve an erection, or erections that are not firm or sustained. Some men experience issues only in specific situations, with a partner, but not during self-stimulation. Typical questions. When did the symptoms start? How often do they occur? Significance. According to Cleveland Clinic, sudden onset ED is often linked to psychological factors like stress, while gradual onset may indicate physical issues like vascular disease. Erectile dysfunction diagnosis. B. Medical history and medications. Signs to watch for. Conditions like diabetes, hypertension, or heart disease may contribute to ED. Certain medications, such as antidepressants or antihypertensives, can also play a role. Typical questions. Do you have any chronic conditions? What medications are you taking? Significance. Mayo Clinic notes that 25% of ED cases are linked to medication side effects, such as beta blockers reducing penile blood flow, medications and ED. C. Lifestyle and habits. Signs to watch. 4. Smoking. Excessive alcohol consumption or a sedentary lifestyle can signal ED risk. Typical questions. Do you smoke? How much alcohol do you consume weekly? Significance. A Journal of Sexual Medicine study found that smokers have a 1.5 to 2 times higher risk of ED due to vascular damage, smoking and ED. D. Psychological and relationship factors. Signs to watch for. Anxiety, stress, or loss of sexual interest may indicate psychogenic ED. Typical questions. Are you experiencing work-related stress? How is your relationship with your partner? Significance. Psychological medicine reports that men with depression have a 2-fold higher risk of ED, depression and ED. 2. Physical examination. A physical exam helps identify physical signs related to ED, from cardiovascular issues to genital abnormalities. Blood pressure and heart rate check. Signs to watch. 4. High blood pressure or irregular heart rate may indicate cardiovascular disease, a common ED cause. Significance. The Journal of the American College of Cardiology notes that ED increases heart disease risk by 50%. ED and heart disease. B. Genital examination. Signs to watch for. Abnormal penile curvature, Peyronie's disease. Small testicles or scarring can affect erectile function. Process. The doctor examines the shape, size, and sensation of the penis and testicles. C. Hormonal signs assessment. Signs to watch for. Gynecomastia. hair loss, or reduced muscle mass may indicate low testosterone. Significance: low testosterone affects 10 to 20% of ED cases. Low testosterone. D. Neurological assessment. Signs to watch for: loss of sensation in the genital area may result from nerve damage due to diabetes or injury. Process: the doctor tests reflexes and sensation to evaluate nerve function. 3. Laboratory tests. Blood and urine tests provide scientific evidence to identify underlying conditions. A. Blood tests. Blood glucose. Diabetes damages blood vessels and nerves, causing ED in 35–75% of men. American Diabetes Association. Cholesterol. High levels contribute to atherosclerosis, reducing penile blood flow. Testosterone. Low levels can reduce libido and erectile capacity. Thyroid function. Thyroid disorders affect hormones and sexual function. B. Urine tests. Significance: detect signs of diabetes or infections that may contribute to ED. 4. Psychological assessment. ED can have psychological roots, and this evaluation identifies emotional factors. A. Questionnaires. Tool. The International Index of Erectile Function, IIEF, assesses ED severity and psychological impact. Significance: approximately 10 to 20% of ED cases are psychogenic. Journal of Sexual Medicine. B. Discussion of stress and relationships. Signs to watch for: performance anxiety, partner conflicts, or depression may contribute. Process: the doctor may refer you to a psychologist if needed. 5. Specialized tests when necessary. Specialized tests distinguish between physical and psychological causes. A. Nocturnal penile tumescence, NPT. Testing. Description: measures natural erections during sleep, 3 to 5 times nightly in healthy men. Significance: normal NPT suggests a psychological cause. Cleveland Clinic. B. Penile Doppler ultrasound. Description: assesses blood flow after injecting a medication to induce an erection. Significance: detects vascular blockages, a common ED cause. Journal of Sexual Medicine. C. Intracavernosal injection test. Description: injects alprostadil to test erectile response. Significance: lack of response may indicate vascular issues. Mayo Clinic. 6. Statistics and advice. Statistics: the Massachusetts Male Aging Study found that 52% of men aged 40 to 70 experience ED. ED is also a warning sign for heart disease. Journal of Sexual Medicine. Advice: don't be afraid to seek help. ED is treatable, and early diagnosis can uncover serious health issues. This process not only identifies the cause of ED, but also improves overall health. Act today. ED is not something you have to endure in silence. It's a treatable medical condition, and early action offers numerous benefits. Don't feel ashamed about seeking help. Millions of men worldwide face ED. You are not alone. View this as an opportunity to prioritize your overall health. Treating ED not only enhances your sex life, but also helps detect and manage serious conditions. Your health is your most valuable asset. Protect it. In our next video, we'll explore effective treatment options for ED, from lifestyle changes to advanced medical interventions. Stay tuned to learn more. If you found this video helpful, please hit like, subscribe, and share to spread this vital information to those who need it. Thank you for watching, and we'll see you in the next video. Welcome back to the Men's Health 60 series. In our previous video, we discussed when to see a doctor for erectile dysfunction, commonly known as ED. Today, in video 4, we'll explore the most common medical treatments to address this condition. If you're experiencing ED, don't worry, you're not alone, and there are many effective solutions available. However, the most critical step is to consult a doctor before starting any treatment. Let's dive in. Part 1. Pharmacological treatments for erectile dysfunction. Erectile dysfunction, ED, is a prevalent condition in men, and phosphodiesterase type 5, PDE5 inhibitors are the first-line treatment due to their ability to enhance blood flow to the penis, facilitating the achievement and maintenance of an erection. In this section, we'll delve into the two most widely used medications, Viagra, sildenafil, and Cialis, tadalafil, supported by scientific evidence, side effects, and key precautions. 1. Viagra, sildenafil. Overview. Approved by the FDA in 1998, Viagra was the first PDE5 inhibitor, marking a breakthrough in ED treatment. Administration. Taken approximately 30 minutes to 1 hour before sexual activity, with effects lasting about 4 hours. Dosage. The typical starting dose is 50 mg, adjustable to 100 mg or 25 mg based on individual response. Efficacy. A 1998 study in the New England Journal of Medicine reported that 74% of men using Viagra experienced improved erections compared to only 16% in the placebo group. Side effects. Common. Headache, 16%. Facial flushing, 10%. Dyspepsia, 7%. Nasal congestion, 4%. Mayo Clinic. Rare but serious. Sudden vision loss or prolonged erection, priapism, requiring immediate medical attention. 2. Cialis, tadalafil. Overview. Approved by the FDA in 2003, Cialis is distinguished by its long duration of action, up to 36 hours, earning it the nickname, the weekend pill. Administration. Can be taken as needed before sexual activity or as a daily low-dose regimen, 2.55 mg, for continuous efficacy. Benefits. Its extended duration offers greater flexibility in planning sexual activity. Efficacy. A 2004 study in European Urology demonstrated that Cialis significantly improves erectile function in older men and those with ED due to diabetes, tadalafil for ED. Side effects. Common. Headache, 11%. Back pain, 5%. Facial flushing, 3%. Rare. Similar to Viagra, including risks of priapism or visual changes. 3. Mechanism of action. Both Viagra and Cialis are PDE5 inhibitors, working by inhibiting the enzyme phosphodiesterase type 5, which enhances nitric oxide levels in the body. Nitric oxide relaxes penile blood vessels, increasing blood flow during sexual stimulation. Research. A 2005 meta-analysis in the Cochrane database of systematic reviews found that PDE5 inhibitors improve erectile function in 67–89% of men, depending on dosage and the underlying cause of ED. 4. Side effects and drug interactions. Side effects. Common. Headache, flushing, dyspepsia, nasal congestion, dizziness. Serious. Sudden vision or hearing loss, extremely rare, 0.1%. Priapism, erection lasting over 4 hours, requiring emergency care. Drug interactions. Nitrates, concomitant use of Viagra or Cialis, with nitrates used for angina, can cause life-threatening hypotension, as warned by the American Heart Association. Other medications, antifungals, ketoconazole, or antihypertensives may increase the risk of side effects. 5. Key precautions. Not suitable for all. Efficacy depends on the cause of ED. For instance, severe nerve damage may reduce responsiveness. Cardiac considerations. Sexual activity can strain the heart, so a cardiovascular evaluation is essential before use. Mandatory physician consultation. A doctor will determine the appropriate dosage and check for drug interactions. A Journal of Sexual Medicine study found that patients under medical supervision report higher satisfaction and fewer side effects. Physician-guided treatment for ED. 6. Conclusion. Viagra and Cialis are highly effective PDE5 inhibitors, backed by robust scientific evidence. However, they carry risks of side effects and dangerous interactions, particularly with nitrates. Always consult a healthcare provider to ensure safety and optimize outcomes. Part 2. Hormone therapy for erectile dysfunction. Hormone therapy, specifically testosterone replacement therapy, TRT, is a treatment option for erectile dysfunction, ED, when low testosterone levels are a contributing factor, particularly in older men. Below are the key aspects of this therapy. 1. Overview: ED can sometimes result from declining testosterone levels. If blood tests indicate testosterone levels below the normal range, typically 300 ng/dL, a doctor may recommend TRT to restore testosterone and improve symptoms. 2. Administration methods. Testosterone can be administered through injections, delivered directly into the muscle, typically every 2 to 4 weeks. Patches, applied to the skin for gradual absorption. Gels, applied daily to the skin for transdermal absorption. Subcutaneous pellets, implanted under the skin, releasing testosterone over 3 to 6 months. Each method has its advantages and drawbacks, and a doctor will recommend the most suitable option based on health status and personal preferences. 3. Benefits: hormone therapy offers several benefits. Improved libido and erectile function. By normalizing testosterone levels, TRT enhances sexual desire and performance. Overall health improvement. Testosterone can boost energy, mood, and muscle strength. 4. Risks and side effects. Despite its efficacy, TRT carries risks. Increased risk of blood clots, may lead to thrombosis, particularly in older men. Prostate issues, can enlarge the prostate or exacerbate underlying conditions like prostate cancer. Sleep apnea, TRT may worsen this condition. Other side effects include oily skin, acne, or reduced sperm count. 5. Monitoring. Due to these risks, medical supervision is mandatory. Regular monitoring of testosterone levels, blood counts, and other health markers. Dosage adjustments or discontinuation if serious side effects occur. 6. Conclusion. Hormone therapy is an effective option for men with ED due to low testosterone, but it requires close medical supervision to ensure safety and efficacy. Part 3. Assistive devices for erectile dysfunction. Next, we explore assistive devices, an option for those who cannot use medications or find them ineffective. The two primary devices are vacuum erection devices, VEDs, and penile implants. Below are details on their function, efficacy, scientific data, and precautions. 1. Vacuum erection device, VED. A. Mechanism of action. Description. A VED is a non-invasive device consisting of a cylindrical tube placed over the penis and a pump, manual or electric, that creates negative pressure to draw blood into the penis, inducing an erection. A constriction ring is then placed at the base to maintain the erection. Duration. Per Mayo Clinic, achieving an erection typically takes 2 to 3 minutes, with the constriction ring sustaining it for up to 30 minutes. B. Efficacy. Data. A Journal of Sexual Medicine study reported that 50–80% of men are satisfied with VEDs, vacuum erection devices for ED. Advantages. Easy to use at home, non-invasive, minimal serious side effects. Disadvantages. Requires practice for proper use, may cause discomfort or minor bruising. C. Risks and precautions. Side effects. Mild pain, bruising, or a cold sensation in the penis. Per Cleveland Clinic, improper use, such as prolonged ring application, can cause tissue damage. Contraindications. Unsuitable for individuals with bleeding disorders or those on anticoagulants without medical guidance. 2. Penile implant. A. Mechanism of action. Description. A surgical procedure involving the implantation of inflatable or semi-rigid rods into the penis to enable erections on demand. Inflatable. Inflated when needed and deflated afterward. Semi-rigid. Permanently firm but bendable. Duration. Surgery lasts approximately 1 to 2 hours, with patients typically discharged the same day or after one night. Mayo Clinic, penile implants. B. Efficacy. Data. A Journal of Urology study found that over 90% of men are satisfied with penile implants post-surgery. Advantages: high reliability. Long-term efficacy, 10 to 15 years. Disadvantages: invasive surgery with potential complications. C. Risks and precautions. Side effects: infection risk, 1 to 3%. Device failure, 5 to 10% after 10 years, or post-surgical pain. Contraindications: not suitable for patients with severe conditions like uncontrolled diabetes or significant cardiovascular disease. 3. Importance of physician consultation. These devices can be effective but require proper guidance, especially for implants, which involve surgery. Consult a doctor too. Select the most appropriate method for your health condition. Avoid risks like tissue damage or infection. Ensure optimal outcomes. A study in the International Journal of Impotence Research found that patients using devices under medical supervision report higher satisfaction and fewer complications. 4. Conclusion. Vacuum erection devices and penile implants are effective solutions for ED, particularly when medications are unsuitable. However, to ensure safety and efficacy, always consult a healthcare provider to understand the benefits and risks and make an informed decision. Part 4. Importance of physician consultation. Throughout this video, we've emphasized the critical need to consult a doctor before trying any treatment. ED is not just an isolated issue. It may signal underlying conditions like cardiovascular disease or diabetes. A doctor will diagnose the root cause of ED, recommend treatments tailored to your health status and current medications, monitor for side effects, and make necessary adjustments. Part 5. Conclusion. In summary, medical treatments for erectile dysfunction, ED, include medications like Viagra and Cialis, hormone therapy, and assistive devices. Each approach has its own benefits and limitations, but the key is to work closely with a doctor to find the best solution for you. Choosing the right treatment not only improves sexual function, but also ensures overall health safety. If you're experiencing ED, don't hesitate to seek help. Early intervention can enhance your quality of life and uncover potential health issues like heart disease or diabetes. Take action today to protect your health. Join us in our next video, where we'll explore lifestyle changes to improve ED. You'll learn how exercises like walking and yoga, a healthy Mediterranean diet, and stress reduction techniques can naturally and sustainably support ED improvement. Don't forget to like, subscribe, and share this video to spread valuable information to others. See you next time. Welcome back to our Men's Health series, where we explore natural and lifestyle-based approaches to improving erectile dysfunction, ED. If you watched video 5, we discussed the importance of a healthy lifestyle, including exercise, diet, and stress management. Today, in video 6, we'll dive into specific home exercises designed to enhance erectile function effectively. These exercises are simple, require no complex equipment, and are backed by scientific evidence demonstrating clear benefits. We'll cover 3 key exercise groups: Kegel exercises to strengthen the pelvic floor, aerobic exercises like brisk walking and cycling to improve blood flow, and yoga to promote relaxation and balance. The goal of this video is not only to provide practical guidance, but also to inspire you to start your journey toward better health today. Whether you're new to exercise or looking to enhance your current routine, these methods are accessible and impactful. Let's explore each section in detail to help you apply them easily and effectively. 1. Kegel exercises, strengthening the pelvic floor. What are Kegel exercises and why are they important? Named after Dr. Arnold Kegel, a gynecologist, Kegel exercises focus on strengthening the pelvic floor muscles, which support the bladder, bowel, and, crucially for men, the penis. These muscles play a vital role in maintaining erectile function by improving blood flow to the pelvic region, enhancing the ability to achieve and sustain erections, and aiding in ejaculation control. Weak pelvic floor muscles can contribute to difficulties maintaining erections or even urinary incontinence. According to a study published in the British Journal of General Practice, approximately 75% of men who consistently performed Kegel exercises for 3 months reported significant improvements in erectile function. Pelvic floor exercises for ED. This makes Kegels a powerful, non-invasive tool for addressing ED. How to perform Kegel exercises. Follow these 3 steps to master Kegel exercises. 1. Identifying the pelvic floor muscles. The easiest way to locate these muscles is to stop urination midstream. The muscles you contract to do this are your pelvic floor muscles. Alternatively, imagine preventing gas from escaping through the rectum. The contraction felt between the anus and scrotum is the pelvic floor. Note: once identified, avoid practicing Kegels during urination regularly, as this may disrupt bladder function. 2. Performing the exercise. Contract the pelvic floor muscles and hold for 5 seconds. Beginners may start with 3 seconds and gradually increase. Relax the muscles for 5 seconds. Repeat this cycle 10 to 15 times per session. As you become more comfortable, extend the hold to 10 seconds and increase repetitions to 20 per session. 3. Frequency and timing. Perform 2 to 3 sessions daily, spacing them a few hours apart. Kegels can be done in any position, sitting, standing, or lying down, and in any setting, from home to the office, or even while waiting for a bus. Benefits of Kegel exercises: improved blood flow. Strong pelvic floor muscles act as a natural pump, enhancing blood flow to the penis during erections. Enhanced erection maintenance. Kegels improve the ability to sustain erections, as evidenced by the British Journal of General Practice study. Better ejaculation control. By strengthening the muscles involved in ejaculation, Kegels can help delay premature ejaculation, extending sexual performance. No equipment needed. Kegels are discreet and require no tools, making them ideal for busy individuals. I genuinely appreciate Kegel exercises for their simplicity and effectiveness. Just 10 to 15 minutes daily can lead to noticeable improvements within weeks. The best part? You don't need a gym or equipment, just commitment. I often do Kegels while working at my desk or watching TV, and they've become an essential part of my routine. If you stay consistent, I'm confident Kegels will be your secret weapon for naturally enhancing sexual health. 2. Aerobic exercises, boosting cardiovascular health. Why are aerobic exercises important for ED? Erectile dysfunction is often linked to impaired blood flow, and cardiovascular health is critical for ensuring efficient blood delivery to the penis. Aerobic exercises, such as brisk walking, cycling, or light jogging, improve heart health, enhance endurance, reduce stress, and support weight management, all of which benefit erectile function. A healthy heart equates to a better pumping system for maintaining erections. A study in the American Journal of Cardiology found that men who engaged in 30 minutes of brisk walking daily reduced their risk of ED by 41% compared to sedentary individuals. Exercise and ED. Aerobic exercise is a cornerstone for addressing ED naturally. Brisk walking. How to perform. Walk at a brisk pace, fast enough to elevate your heart rate and make breathing slightly labored, but you should still be able to talk comfortably. Aim for 30 minutes daily, at least 5 days per week. Beginners can split this into 10 to 15-minute sessions and gradually increase duration. Wear comfortable shoes and choose flat terrain to prevent injury. Benefits. Enhances blood circulation, crucial for erectile function, reduces body fat, improves mood, and boosts energy levels. I love brisk walking in the early morning or late afternoon. It's both exercise and a chance to enjoy fresh air. It's a fantastic way to start the day or unwind after work. For busy schedules, even walking to a nearby store instead of driving is a great start. Cycling. How to perform. Cycle for 30 to 60 minutes, 3 to 4 times per week, either outdoors or on a stationary bike. Start at a moderate pace, increasing intensity as you gain confidence. Ensure the saddle is properly adjusted to avoid excessive pressure on the pelvic area. Benefits. A study in the Mayo Journal of Sexual Medicine found that men who cycle regularly have better erectile function than those who don't exercise. Cycling and sexual health. Cycling strengthens leg muscles, improves endurance, and enhances cardiovascular health. Precautions. Choose a wide, cushioned saddle to minimize pelvic pressure. If you experience numbness or discomfort, adjust your posture or take breaks. I particularly enjoy outdoor cycling. It's not just exercise, but also a way to relax and explore. If you prefer indoor cycling, pairing it with music or a video keeps it engaging. General benefits of aerobic exercise. Improves blood flow, reducing the risk of hypertension and high cholesterol, both linked to ED. Lowers stress and enhances mood, boosting confidence in sexual performance. 3. Yoga, relaxation and flexibility. How does yoga support ED? Yoga is more than just physical exercise. It's a holistic practice that integrates body and mind. It reduces stress, improves blood flow, and strengthens pelvic floor muscles, all critical for erectile function. A study in the Journal of Sexual Medicine demonstrated that yoga can enhance sexual function in men by positively impacting the nervous system and circulation. Yoga and sexual function. 3 effective yoga poses. 1. Cobra pose, Bhujangasana. How to perform. Lie face down, place hands under shoulders, inhale, and lift your chest while keeping shoulders relaxed. Hold for 15 to 30 seconds, then exhale and lower. Repeat 3 to 5 times. Benefits. Increases blood flow to the pelvic region, enhances spinal flexibility, and reduces stress. I start my day with this pose. It's invigorating and energizing. It's simple, yet highly effective for both physical and mental health. 2. Bridge pose, Setu Bandhasana. How to perform. Lie on your back, bend your knees, and place feet near your hips. Inhale, lift your hips, contract your glutes. Hold for 20 to 30 seconds, then lower. Repeat 3 to 5 times. Benefits. Strengthens pelvic floor muscles, supports lower back health, and improves circulation. This is my favorite pose because it not only aids ED, but also relieves lower back pain, which is great if you sit a lot. 3. Legs up the wall pose, Viparita Karani. How to perform. Sit close to a wall, lie back, and extend your legs up the wall. Hold for 5 to 10 minutes, breathing deeply and relaxing. Benefits. Reduces stress, improves circulation, and promotes complete relaxation. I practice this pose in the evening to unwind and prepare for restful sleep. It feels like a natural remedy for stress. Tips for practicing yoga. Focus on deep, steady breathing to maximize benefits. Start slowly and gradually increase pose duration and intensity. Combine yoga with short meditation sessions for enhanced relaxation. Conclusion. Kegel exercises, aerobic activities, and yoga are powerful, accessible methods. You can practice at home to support erectile function. Kegels strengthen the pelvic floor, aerobics improve blood flow, and yoga balances physical and mental health. The key is consistency. Dedicate time each day, and you'll notice positive changes within weeks. Start with small steps: 10 minutes of Kegels, 30 minutes of brisk walking, and a few simple yoga poses. As you grow comfortable, increase intensity and integrate these into your daily routine. These exercises not only address ED, but also enhance overall health, boosting your confidence and quality of life. Exercise is just one piece of the puzzle. Nutrition plays a crucial role in improving ED. Watch our next video to discover the best foods for erectile health. Don't forget to subscribe and turn on notifications to stay updated. Thank you for watching video 6, and we'll see you in the next one.